And I'm Dr. Jolene Brighten. We are talking through Beyond the Pill Chapter 4 today, Take Back Your Period. And in this chapter, we are going to go through the most common period problems that makes doctors want to prescribe us the pill. And that is why the book is called Beyond the Pill, is because I wanted to offer you root cause solutions beyond hormonal birth control. Because it seems that, like, every time you go to the doctor and you're like, I got a period problem, they're like, here's a pill for that, or an IUD, or a patch. And so this chapter is all about giving you the solutions beyond birth control and helping you understand and work with your body. Now, I'm going to be honest with you guys. I'm sitting in a hotel room right now in Los Angeles. So here I am with a bed in the background. I know that sooner or later someone was going to say, is that a bed in the background? Yep. And there's a suitcase over there. The YouTube people can see that. But I'm traveling. I'm at the Bulletproof Conference this weekend. I also have interviews coming up. So Dr. G and I are interviewing this evening. And then I'm interviewing on Sex with Emily Radio. That's going to happen tomorrow afternoon. So stay tuned for that. You can catch all the details in my Instagram stories. So we are going into chapter 4. Chapter 4 is Take Back Your Period. And as we get into chapter 4, we're talking through PCOS, PMS, talking about the 5th vital sign. So the American College of Obstetricians and Gynecologists, they decided back in 2015 that your period was the new vital sign. So vital signs are things that every doctor evaluates, or sometimes the nurse or medical assistant evaluates as soon as you go into the office. So we want to know what's your blood pressure, what's your temperature, are you at risk of any health complications just based on those vital signs. Your period and menstrual cycle provides that data as well for us. So that was something that was really revolutionary in women's medicine, to actually get the acknowledgement that our periods are important. So in this chapter, we go through decoding the 5th vital sign, and so what your period actually says about your health and how you can look at your symptoms to get answers about what's going on internally and guide you towards solutions. Any woman that goes to her doctor should be evaluated, not just by labs, but by symptoms as well. And this is what I do differently as a women's endocrinologist and specializing in root cause medicine as a naturopathic physician. I really look at what is going on with the root cause and how do your symptoms correspond with your labs. And I teach you how to do that in this chapter. So if you saw my Instagram post today, I was talking about heavy periods, foods that you can eat for heavy periods. So in this chapter, we go through very heavy, very long periods. That's where we start. And I know there were questions about, well, what if my period doesn't seem very heavy, but it lasts 10 days? There is a menorrhagia checklist. So menorrhagia is the medical term for periods that are just way too heavy and way too long. You're losing way too much blood. And there's a reason for that. So I take you through a checklist so you can do a quick evaluation. As you're learning and Beyond the Pill, there are tons of quizzes and checklists and things like that just to really help you be targeted. My team knows the way I like to be communicated to is with bullet points and really just like concise information. And I try to do the same for you because we've got so much coming out at us all day, every day in terms of information. And we're busy. And if you've got a hormone imbalance, you don't have time to read an entire book to figure out what is going on. So as you go through chapter 4, there's a couple things that go on. One is, so let's just take painful periods. So I explain, just me. I explain painful periods and, what is it, what's normal and what's not normal? Because how many of us go through our life not knowing what is normal and what's not normal when it comes to our periods? And then our doctors are like, oh, that's just normal, when in fact it's common, but it's not normal. And they think it's normal because that's who comes to their office all the time. And in reality, it's not normal, not at all. So with painful periods, I talk through what are the considerations, what causes painful periods. I give you lab testing for each of your period problems you might be facing. Here's lab testing to consider. If you have already grabbed a copy of Beyond the Pill, go to beyondthepillbook.com. Download the free resources because I have a lab guide in there. And what that lab guide did, I couldn't put this in the book, but there's a link there for you to be able to access a lab company where you can direct order your lab. So if your doctor's not willing to order it, this lab company will hook you up and they give you a Dutch panel at a discounted price. So beyondthepillbook.com, you can grab those bonuses. They're gratitude bonuses for anybody who is supporting the mission of Beyond the Pill. So In this, I talk about lab testing. Then every single section has what to do right now. What to do right now. So if you are like, okay, I have painful periods, I need to go get C-reactive protein tested. Maybe I need to get an ultrasound. I'm making an appointment for my doctor. We go into what to do right now, because you shouldn't, like, sometimes it takes a month to get into your doctor. You shouldn't have another menstrual cycle that is like completely owning you with pain without bringing in some root cause interventions and supporting your body. And that's because healing your period problems, healing your hormones takes time. In fact, if we look at Vitex alone, the studies have shown that Vitex can take up to 3 months to really take effect. So it's always better to start these things sooner than later. When it comes to natural therapies, it's very rare that they work overnight. Magnesium is one of those that can work like almost instantly, it seems. But when you're working to really turn the symptoms around naturally, you're working with your body, healing takes time. This is very juxtaposed to the allopathic mindset of like, here is a pill, shut up body with those symptoms, let's suppress them so you feel better right away. There is a time and a place for both, okay? That is not to say that one medicine is better than the other. In fact, we need all of these different philosophical approaches to the body, whether that be functional medicine, naturopathic medicine, allopathic medicine, Chinese medicine, even, massage therapists, really awesome farmers, like all of this comes into play so then we can really address the chronic crisis of disease that we have currently. So with that and the what to do right now, I talk about, so one thing is magnesium glycinate. I see that coming up. Good magnesium supplement. Go to drbrighten.com. My Magnesium Plus is the one that I recommend in my practice, because if you have painful periods, you're probably going to be pooping a lot too. And it talks about that there and why you won't want to take magnesium citrate. So magnesium glycinate, and I give you dosages in the book. So starting with 300 milligrams, and I take you through how to do that leading up to your period when you want to increase dosage so you can make those period cramps go away. I talk through, so every time we get into like specific nutrients, I also talk about food. So I'm like, here's the food to get it in, and then here is the supplement that you might want to consider. And my team just put up the Magnesium Plus for everybody on Instagram. You can click that link right there and check it out. So we go into light periods, late or irregular periods, also very common. So what's a light period? A period that's less than 3 days. What is that usually indicative of? It's usually indicative of too little estrogen. Has your doctor tested your estrogen? Has your doctor tested it on the right day? I just had somebody the other day message me and they're like, I got my labs drawn and my progesterone is way too low. And I'm like, what day did they test it on? Day 11 of my cycle. Well, did you ovulate? No, I hadn't ovulated yet. That's the wrong day to test then. Like that's a perfect progesterone. Your doctor said it was normal. They're right. Totally normal. You have low progesterone because you only get progesterone after ovulation. So if you're testing it in the follicular phase, you're not going to see much progesterone. Your doctor's going to be like, that's normal. True. But that's not the time of the month we need to test it to evaluate, is your PMS due to low progesterone? So we talk about late, irregular periods, what testing you should be done, having done. And in this chapter, I'm really trying to help you understand that if you want to use the pill for your symptom management, totally fine, but you still have to ask these questions. Your doctor doesn't get to be that lazy. It's kind of lazy, right? I don't want to say that because I love me some doctors. I am a doctor. And my best friends are doctors, but really like to be like, you have symptoms, here's a pill, see you later. Like, yo, what about all this stuff? What about all this stuff it could be? What if I have endometriosis? Like, we should be asking that. So in the book, I take you through what could this possibly be? What could be the mechanism of action? What labs should you test? What days should you test those labs based on these symptoms that you're having? And really helping you understand what you can do right now. We then go into short cycles. What's a short cycle? If your period comes so if it's like, my period comes every 19 days, problem. So a period shouldn't be coming more frequently than every 21 days. What are we doing in this chapter? We're dispelling common myths about our periods and helping you know it's normal. Like, let me tell you, I wish that someone had given me this book when I was like 12 and I could have read up on it. And then at 14, when my period came, I wouldn't have been like, oh, bleeding for like 7 to 10 days is normal, and bleeding through a tampon and pad every hour is normal. And of course, I'm going to be ruining all my clothes. Like, that's not normal. That was never normal. Should have never been considered normal. And not even my mom knew that. And my mom was like, well, you know, they thought I had endometriosis when I was your age, so you probably have endometriosis. And the doctor was like, yeah, you probably have endometriosis, because I was in so much pain that I would throw up with my periods. I didn't have endometriosis. I actually probably had an elevation in prostaglandins and estrogen dominance going on. And had I addressed those two things, it would have also helped with my moods and my joints and so many other symptoms. But everybody was very focused on what's up with this girl's periods and not focused on the fact that hormones impact every single system in our body. Now, for everybody who's been asking me about missing periods, we hit it here. What happens when your period's gone? What if it's hypothalamic pituitary, not talking? So HPO axis, hypothalamic pituitary ovarian axis, not communicating accurately. That A is for adrenal. And by the way, the ovarian, adrenal, and thyroid axis all go together in making periods disappear. So that's why I was like jumbling the words there, because we talk about that in this section. So I talk about, post-birth control syndrome, what is known as post-pill amenorrhea, functional hypothalamic amenorrhea, pituitary dysfunction, ovarian dysfunction, hypothyroidism. Like, what are the big reasons that cause our period to go missing other than pregnancy? And of course, if your period is missing and you're sexually active, step one is always a pregnancy test. So that is listed in the lab test. And I take you through like what to do right now. Now, the other thing that I did in this chapter is I also talked about pain and bleeding with sex, because this is something else we don't talk about in society. We don't talk about what's normal and what's not normal with sex. And that's because there's a gradient and a spectrum, and there's personal preference. The things like having pain with intercourse is not normal. But let's flesh this out for a second. Maybe on Sex with Emily tomorrow. And that's a live radio show on Sirius XM. And then she puts it into a podcast, so it'll be coming. But, I was actually I was texting with my friend, Sean Stevenson, check out the Model Health Show if you haven't. I love Sean. And he's like, let's get lunch. I'm like, well, I have this interview with Sex with Emily. And he's like, oh, what is that about? First time on the show? I'm like, no, this is the second time. We had such a good time talking about all the things that we're not supposed to talk about that we decided to do it again. And so I want to spend a minute here just to say that pain with intercourse is not normal unless it's a positional kind of thing. So if you have pain, if anything about to penetrate you comes near you and you have pain, that is not normal. What do I mean by that? Having pain inserting a tampon, also not normal. Pain inserting a Diva cup, also not normal. But with that, if we have pain at the introitus, which is the opening of the vagina, that is not normal. If you're having pain and discomfort with intercourse and you change positions, but something doesn't feel right, it's always a good idea to get this checked out with a doctor. Changes in bowel movements or new onset of pain with intercourse, they can be signs of things like ovarian cancer. It's not to freak you out. It's to say, don't dismiss yourself, because this is something I do, lots of women do, where we're like, I think I have this problem, but is it really a problem? And should I really see a doctor? And like, I don't really want to have to go to the doctor, because nobody wants to get on that gyne table and have a speculum exam. Okay. I've done my share of performing those, and I still don't want to get on the table and have it done to me. And I know what's about to go down. But with that, when I talk about what's called deep dyspareunia, so that is deep penetration that is causing pain, that could be an anatomical thing. So if a penis or any object ever strikes your cervix abruptly, it hurts. It hurts. Okay. So that is something that's like a caveat of like, okay, maybe you're in a position, the penetration is deeper, and then like you have pain, but it's fleeting. That is considered normal. Everything else we talked about, not so much. And if you bleed with sex, that is not normal. Now, if you're like about to start your period, totally normal. If there was like a lot of friction and you weren't using lubricant, there could be like a little bit of blood because the tissue was, basically rubbed raw, for lack of a better term. I try as I come to you guys not to use like a ton of medical jargon, because then nobody understands what I'm talking about. But with that, if you see blood after having sex, go to your doctor. So I spend some time chatting about that. And then there's a whole chapter dedicated to orgasms, libido, sex, baby making, all of that, because we have to be talking about these things. So many times I have women come into my office and they're like, I've like never had an orgasm. Like, that's just normal, right? My doctor told me that's normal. That is not normal. Now, it might be that like you and your partner need to figure some things out and there's something else going on. But like if you have an inability to orgasm, that actually can be a sign of a medical disorder. And so understand that these things that are seen as like, bonuses, benefits, frivolous, like you shouldn't talk about it, like all this stuff about being a woman that was like, of a sexual nature that it's like, don't talk about it. Some of those things can actually be signs that there's an underlying issue. And in my practice, we evaluate every single woman's libido, because if you don't have a libido, you likely have adrenal, progesterone, testosterone, and estrogen issues. And we definitely have to check the thyroid in all of that. When I see the question about tests are normal for thyroid, super common for doctors to say your thyroid panel is normal. However, it is super common as a woman to have a thyroid condition. In fact, women are 5 to 8 times more likely to develop a thyroid condition. Labs can look normal if you look through them through the conventional lens, which is to say that basically how labs are brought together as a normal reference range is they look at the population and they're just like, what's the average? Except that with thyroid, the average population getting tested does have hypothyroidism and may even be elderly. So it's not an appropriate reference range. So with that, if your doctor only checks your TSH, no go. You have to do TSH, free T4, free T3, reverse T3, TPO antibodies, thyroglobulin antibodies. If you missed all of that, rewind, watch it again, or get Beyond the Pill and I talk through that. There's a whole thyroid chapter, and we'll go deeper on that when we go to the thyroid chapter. But with that, just know that you can also have cellular resistance where your thyroid labs look totally normal, but at the cellular level, you're not getting them in. That takes an expert who's worked with a lot of thyroid cases to really flush that out. And so just understand your doctor can say your labs are normal, but labs are one snapshot in time. Your experience in your body is a daily occurrence. So chart your data. And that's what I teach you to do in Beyond the Pill. Drinking water. It's a travel day for me, and any travel day is like doubling up the water like crazy because planes they dehydrate you. And in addition, they spray nasty stuff on those planes, and you are exposed to toxins big time when you fly. And I know that sucks. I just did an Uber ride and I had to put the window down because, there's the cologne situation for real, but there's also the air freshener situation. And drinking more water will help your body flush out those toxins. It supports natural detoxification, which we talk about in Beyond the Pill. Now, there's a whole section on PMS, also not normal. It is not normal to hate yourself, your life, and everybody in your life 1 to 2 weeks out of the month. Not normal at all. So I talk through PMS. Very common to have, And us ladies put up with a lot of stuff. So we do have to like flush out, like, is this our hormones or is this the people in our life that maybe we got to say bye-bye to? Now, I take you through what do you want to, be looking at, but like I get in with PMS right away into what to do right now, because with PMS, like I was saying, I say try Vitex here. Vitex can take like good 3 months to take effect. Healthy takes guts. Everything you just said about thyroid labs, all the exclamation points. That's awesome. Do you speak only on women's health that is pre-menopause? So let's just say, let me just say this. If you're postmenopausal, that means you haven't had a period in a year. Everything I talk about with liver, gut, thyroid, adrenal health applies to you. Brain health applies to you. Liver detox, that applies to you. What doesn't apply to you is syncing up your cycle with the moon. Okay, you're not having a cycle. So all of those things still apply to you when you go through menopause. And really, if you're in perimenopause, you want to grab this and get into chapter 4 stat and take the quiz that happens in chapter 1 to understand where your hormone imbalance is. In perimenopause, we will sometimes start having hot flashes, anxiety, night sweats, not sleeping. We think it's all about progesterone and estrogen. I help you understand, is it? Or is this a sign of thyroid dysfunction? Or is this a sign of adrenal dysfunction? So we've got to be looking at all those things and know that every single woman in the entire world, no exceptions, needs to support her liver and gut if she ever stands any chance at having any of her hormones set right. And we will be talking a lot more about that in the next couple of days. Now, I go into a bit about how the pill can cause weight gain in my book, and alcohol and estrogen dominance, and just going through how do we fix estrogen dominance? Probably one of the worst things to plague us ladies. And I take you through like, what do you need to be doing, and then get you into chapters to start teaching you how to do all of this. Now, the thing that you guys have been writing me saying your favorite part of this chapter, besides like getting and figuring out and knowing you're not crazy, because we're not crazy, is this remedies section. So this chart here that goes right into the supplements. Now, like I said, in the chapter, we go through all this food as medicine. There are also supplement recommendations in there. In the back of the book, all kinds of food as medicine, lifestyle factors, but I wanted to give a really concise table on supplements to use. I mentioned my brands, and I also mentioned other brands that I would say are, you know, great alternatives. If you're like in another country and you can't get my brand of supplements, take a look at this chapter. I give you a couple of recommendations here for you to check out. And I go into like, you guys, seriously, one of my favorite tried and true tinctures, herbs ever for period pain is cramp bark. You can use this if you have period pain, if you have postpartum, afterbirth pain. It is such an awesome herb. So I talk about how to dose that for period cramps and how you can utilize that. And then we get to the end of the chapter with the key takeaways of things that you want to know. Like, hey, if you are spotting mid-cycle, it might be ovulation, or it might be fibroids, infection, endometriosis, cancer, or pregnancy. We should know that. And nobody likes to talk about like the C word. Not that C word. I'm talking about cancer. Nobody wants to talk about that, but we should be in the know on that, because the sooner you can catch things, the better off you're going to be. So I saw the question about endometriosis. So I do talk about period pain, and endometriosis comes up several times in chapter 4. Yes. Of course, I'm going to talk about endometriosis and PCOS in this book, because you ladies are the ones who are prescribed hormonal birth control at one of the highest rates. And actually, when you look at period pain altogether, that is a very high prescriptive rate for the pill. So let's jump into some questions here. We went through the book. I see we've got people on YouTube and on Instagram here. Thank you guys for being here with me. If you're just jumping on, yes, that's the bed in the background. Yes, I am sitting in a hotel room. I am currently here for the Bulletproof Conference. If you're here, let me know. Let's chat. But let's go through. Let's answer some questions. What are your questions from chapter 4 of Beyond the Pill? So I can help answer those. And well, so tons coming in. So I see daily widespread muscle spasms for unknown reason, days before my period, unbearable. Any idea why? I'm 50, have Hashimoto's. You know, that's something, Mama Puckett, I would talk with your doctor about and check into calcium and magnesium levels, because when those get low, that can lead to muscle spasms. And as you're gearing up for your period and your hormones are shifting, your need for calcium and magnesium can go up, especially if we're having PMS and other hormonal symptoms. If your symptoms are cyclical, you guys, there's a good chance it's related to your hormones fluctuating in your menstrual cycle. So you've had your period for 15 months straight, 14 months of Depo. Michelle, Depo not working for you, not working for you. So that is a common side effect of that medical intervention. But whenever we have a medical intervention and we start having side effects, the question we have to ask is, do we have to really live with this side effect? Like, is this really how, like, we have to live? And the answer is no. Like, there are other contraceptives out there. I get into chapter 13 about non-hormonal birth control. We'll be visiting that soon. We're on chapter 4 right now, so we got to get to chapter 13. But if you're having your period for that long, you need to investigate why. And you want to look at the heavy period section, because there's testing your doctor should do. Even if it's a Depo, even if it's like, oh, that's normal with Depo, doesn't mean you're not iron deficient or B12 deficient, and you definitely need to check into that. You're taking Vitex for low progesterone and was wondering if I should keep taking it if I get pregnant. You saw somewhere that you can take it till the end of the first trimester. So here's the thing I will say about pregnancy. The moment you are pregnant, you need to call your doctor and you need to talk to them about the herbs that you are on. There are many eclectic herbalists, OB gynecologists who are well-versed in herbs, and midwives who will use Vitex through the first trimester to help with miscarriage prevention, but you've got to get the dose right and you need to be testing your progesterone. And we don't mess around in pregnancy. So like in my office, you're pregnant, you're over to the midwife or the gynecologist stat, because I need to make sure that we're partnered together. I don't catch babies. I can help you get pregnant, optimize your body, stay healthy through pregnancy, have an awesome postpartum, but I'm never going to catch that baby. So the person catching that baby needs to be in the know of what is going on. And for those of you who are asking, Balance is back in stock. So that is my #1 hormone supportive supplement that you guys love and that I love. And I'm so glad it's back in stock because I ran out. And oh my God, I knew I was about to travel and I was like, I have this trip, and if I travel and I don't have that, and like, I know that my hormones are not going to be right. Because again, I'm exposed to a lot of environmental toxins when I travel. And that is part of what Balance does, is that it not only helps with your natural hormones, but it also helps with these xenoestrogens that you encounter. And so, and for those of you who are like, why was Balance on back order forever? It was because one of the ingredients we sourced, when we tested it, it was not as potent as we had claimed on the bottle. And so we did not move forward. Nobody got a bad batch. No one got a bad batch at all. I didn't let that happen, but it was a tough call. And my manufacturer was like, just put it in. And there's other stuff that's in there that'll work. And I'm like, I can't do it. It kept me up at night. I was like, I can't do it. I can't say I'm doing one thing and not do it. That's my personality type right there. I'm a rule follower. And if I ever feel out of integrity, I just stop sleeping and I'm a ball of stress. So you know what? Not worth it. But Balance is back in stock. I know it's already flying off the shelf. So if you're thinking about grabbing it, definitely grab it. My team just put a link there on Instagram so you can check it out. YouTube, you can go to drbrighten.com/ /product/balance, or you can just search Balance on there. Vaginal dryness week before my period, normal or worth looking into? So this is a great question. And one of the things that I did not get to go into mass detail on in my book because you guys, this is an over 80,000 word book. It was supposed to be 65,000. I submitted 100,000 words and then proceeded to go back and forth with my publishers. So one of the things was like going in depth about vaginal secretions. And it's something like, I actually just published an article today about yeast vaginitis, yeast infections. See, there's my medical jargon. I'm like, what's the normal way to say yeast vaginitis? Yeast infections, because that's something that happens with the pill as well and can be part of your period problems in chapter 4. We had to cut some of that information out. So guess what? I made an article for you and it's on my blog right now at drbrighten.com. So with that, our secretions vary throughout the month. So we are, we're on the new moon. I'm an ovulator on the new moon. You'll read all about that and be on the pill. And we'll get into menstrual cycles and moon cycles a whole lot more. That's something else I wrote a whole chapter about. And they were like, you can't have a whole chapter about moon cycles. And I'm like, fine, I'll just write a whole book on moon cycles then, whatever. But there is quite a bit of information about moon cycles. So there's a good chance a lot of you are also ovulating with the new moon. So right now, you're going to have more vaginal secretions. It'll be thick, like egg white. And so not like raw egg white. So like when you crack open an egg and it's all goopy, you actually want to see that in your panties. It's a very, very good thing. And so that is a sign that you are ovulating. And so that is also a time your testosterone rises. And as we were talking about in the lowdown on your hormones, so go back, watch the chapter 2 video about how your menstrual cycle works. Testosterone rises, vaginal secretions are up. Now you're like, my estrogen's up, I'm all curvy, I'm looking good, my lips are plump, and then your testosterone's up and you're like, I'm feeling sexy and I'm in the mood. Then your vaginal secretions come up, your body's working with you, is like, yeah, girl, I got your back, and it can be easier to have orgasms. But as we get closer to our period, things can dry up a bit. And if it's so dry that like you go to the bathroom, I almost said potty. Can you tell I hang out with a child, that I have a child in my house? I almost said potty. But when you go to the bathroom and you wipe with toilet paper, if it hurts or it feels like super, super dry and uncomfortable, that's a problem. But having vaginal dryness, like leading up to your period and feeling like when I engage in sexual intercourse, I need to have more lubricant, that's not uncommon. But if it's so dry that you're uncomfortable, it's painful, that's an issue. And as I talk about, so I do give recommendations for vaginal dryness in the book. And one of the things is actually applying vitamin E. And vitamin E is very nourishing for the mucosa of the vaginal tissue, which is what makes secretions. It will break down a condom though. So if you don't want a baby or an STI and you're using condoms, no vitamin E applied before the condom. So your anxiety spikes before and during ovulation. It's getting worse. What could that be caused by? So I would track your symptoms of anxiety, and I would track your other symptoms along with it. If it's spiking, around ovulation, that's a time where we don't typically see anxiety. We typically see it later on, but it is possible that estrogen levels are fluctuating, or it has nothing to do with estrogen and progesterone specifically, and everything to do with the strain on your adrenal glands and what's happening with them. But maybe you're spiking epinephrine, norepinephrine. I'd also track a diet diary along with that to understand, am I eating differently as I get closer to ovulation? Is there any foods that can be triggering that? And then pay attention to digestion, because as our hormones fluctuate, so as our estrogen, progesterone, testosterone fluctuate, the same thing will happen where your thyroid and your cortisol will start to fluctuate as well. And then digestion can change. And if your digestive tract is getting all hot and bothered, that'll actually send signals up to the brain that will put you into panic. And so I see Tanya's asking, is fluid retention in the fingers bilateral? Are you a healthcare provider? You're even telling me bilateral. Associated with estrogen dominance? It can be. So estrogen will make us hold on to water, especially when progesterone gets low. Progesterone is a diuretic, and so that helps with water weight. It'll move out water. But if you don't have adequate progesterone, or you're using progestin hormonal birth control, so whether that's combination pill, the mini pill, the IUD, and you are not ovulating, depot shot as well, then you're not going to get that diuretic effect. And so you can hold on to more water. And I talk about that in the book. And I also talk about using dandelion leaf tea, not dandelion root. Dandelion root is really, really good for your liver. It can be really, really helpful in PCOS, excess androgens, but dandelion leaf is what you want if you've got swollen tissues going on. So thanks for that question, Tanya. What are the main supplements you recommend for overall health and hormone balance? So Moose Gueda, I think is how you say your handle. So there is a quiz for you to take. So, one thing I will say, I think that, what I'm going to roll with, my plans for the rest of my life is a prenatal or multivitamin, depending on my period in that stage of life, omega-3 fatty acids for sure. So like my omega plus, and my balance supplement, that one's staying with me for life. Going to be friends, and probiotics, vitamin D. I live in the Pacific Northwest. I have to take vitamin D, non-negotiable. You live that high up from the equator and your risk of breast cancer is way too high. You need your vitamin D. So those are the things that I consider, but there's a quiz in the book to help you get dialed in on your hormone imbalance and understand what supplements might work best for you. We're going to talk tomorrow about liver. Then we're going to talk about gut after that. There's specific supplement considerations for that as well. And the nice thing about having this book is you can go back to the quiz and you can take it again in the future. So 3 years from now, you can take the quiz again and be like, where am I at? What do I need to do? 10 years from now, go back to the book, take the quiz. Like that's, this is a resource that I designed. When I approached this book, I'm like, I want you to buy this book, and I want you to pull this book off the shelf, like, once a month to begin with. And after that, you're feeling so awesome that it's like, you're pulling it off the shelf to like talk to your friends about what's going on with their period problems. But I did not want this to be a book where you read it, you're like, that information's great, put it on the shelf. And then it's, you know how like fashion goes out of style? This will never go out of style. And so there will be more editions in the future. That's the plan, as we learn more information. But everything in here with the diet and lifestyle is stuff that's been tried and true, well, since like humans stepped onto the scene, but also in the research. I mean, we go back like decades upon decades with like, we know this information to be true. So I see questions about SIBO. We'll be talking about SIBO when we get to the gut chapter. I also see my team is putting in information about the supplements. Megan, would you also mind putting in drbrighten.com? There's a SIBO article there. I actually give you a bunch of information on how to treat SIBO naturally. So with Beyond the Pill and the supplements, the idea is I want you to build a really strong foundation with your diet and lifestyle, that you're only taking the supplements you need. There are, I've seen this in health books where it's like everybody needs to take all these supplements, but that is something I have patients come to my office and they're taking, no joke, you guys, sometimes patients have come to my office with a suitcase, like a rolling suitcase full of supplements. And they're like, why am I not feeling better? And it's like, everything that's in there is really, really good, but we need to fine tune it based on what's going on. And that's what I help you do in the book. Do you need K2 to absorb vitamin D? That's a great question. So vitamin D is talked about in chapter 4 because it can really help with period problems. Vitamin D is something, for a long time, we were like, great, vitamin D is so good for bone health. Why is vitamin D going to be with me for my life? Not just because I live in the Pacific Northwest, but because I have autoimmune disease. And vitamin D keeps autoimmunity in check via the Th3 immune system. We'll talk about that more when we get into the gut check chapter. But with that, why we put K2 into vitamin D. So what I was going to say though, vitamin D acts a lot like a hormone. We need more research on this to understand all the ways that it affects us. But with vitamin K2, why we put that into a vitamin D supplement is because there's vitamin D toxicity where you have way too much, but there's also that you're just dosing vitamin D. Without K2, it can pull calcium into the arterial walls, so into your blood vessels. That makes them rigid. That is how we end up with cardiovascular issues. And so the K2 is there to make sure you're taking care of your bones, like pull the calcium into your bones, not into your blood vessels. So great question with that. And you'll see that my vitamin D has K2 in it as well. So guys, I want to thank you for being here. Stay with me in the Instagram stories because I am going to be at the Bulletproof Conference. I'm also going to be at several interviews in LA. I am connecting with some of my favorite people. I'd love to hear from you in the comments, like what was most helpful for you in chapter 4? What was most helpful in watching this video? If you don't subscribe to my YouTube, do that now, because then every time I go live, you'll get a notification. And these videos that I'm recording, they are on Instagram and they are on YouTube, but Instagram only keeps them around for 24 hours. So you want to head over to YouTube for that. Remember, you can buy Beyond the Pill anywhere they sell books. It's on sale right now as we're talking for 35% off on Amazon, which is pretty awesome. And when you grab Beyond the Pill, go to beyondthepillbook.com. Get your bonuses, get your little gratitude goodies. Oh, I love that you guys are saying you love the book. That is awesome. Make sure you tag your friends, tell your friends what we're up to. We're having a little virtual, book party together. Really going through having our own little book club and discussing this further, which I want to say thank you for your messages around this. I've had so many messages of women writing me saying, I cannot believe you are doing, I get to sit in a book club live with the author who wrote the book. And I'm like, I didn't think that was like, I was like, I just want to support you guys and help you guys. But I was like, yeah, that is kind of cool. Like I wrote the book and I'm going to talk to you about the book. Yeah, I'm not as cool. I don't think I'm as cool as like you guys do think I'm as cool. That didn't even come out right. That's how not cool I am. Oh, I see that you got your book today. That is fantastic. Your book arrives tomorrow. You can't wait. That is awesome. Keep tagging your friends, supporting one another, share this wherever you can. And I will be back tomorrow, where we will be talking about the gut check chapter. So bring your SIBO questions, your yeast overgrowth questions, so candida, bacterial dysbiosis, autoimmune disease. We're going to talk about inflammatory bowel disease, and we're going to talk about how important your gut is. And I just lied. Actually, tomorrow's the liver chapter, and I got ahead of myself because of the SIBO info. I told you I'm not cool. So tomorrow's the liver chapter, then the gut chapter. So tomorrow, bring your questions about liver detoxification. We're going to talk through estrogen metabolism, and we're going to go through how you have to love your liver to get your estrogen right. And this applies to any woman anywhere in the world. Whether you have ovaries, you don't have ovaries, you're taking bioidenticals, you're not. If you have estrogen in your life in any way, P.S., the environment is dosing you with estrogen all the time, you definitely want to watch tomorrow's video. You definitely want to check out the liver chapter in Beyond the Pill. It's actually called Birth Control Hormone Detox 101. But I wanted to call it the liver chapter, so I keep referring to it as the liver chapter. But my publishers, they were like, that's not sexy. And I'm like, I know. They look out for you guys. Did you miss the period talk? We talked about the lowdown on your hormones. That was chapter 2, so go look for that. You can find that video on YouTube. And then we talked today about period problems, so you want to go back and watch this video as well. I will see you guys tomorrow. Thank you for being here with me. Thank you for supporting Beyond the Pill. And then I will see you tomorrow. And so for everybody who is